Hello friends and welcome back to my YouTube channel. It is your girl as always, Calista Daniels in the building. I hope you guys are doing great, and for me, I am having a very beautiful day, a beautiful morning because the day just started. And this morning I'm bringing you guys something very important and essential. We'll be talking about women's health and I'm going to take it in series. So this is going to be a kind of part one of the series to come. So for today, we'll be talking about the menstrual cycle. And you cannot talk about the menstrual cycle without talking about um, menstruation, the symptoms, the signs, and all what's not that accompanies menstruation. So what is menstruation? Menstruation basically is the shedding of the endometrial lining of the uterus, which the layman called the womb. And this is accompanied by the bleeding that we experience every single month. Yeah. And there are some hormones that are responsible for the shedding of the endometrium or the shedding of or responsible for menstruation, which I will not be going really deep into that so that I don't confuse those of us who are not into the medical line. And these hormones are estrogen and progesterone. Whatever we experience as a woman boils down to these two hormones in terms of our menstrual cycle and all that accompanies it. If there's any issue with these hormones, automatically there will be issues in our menstrual cycle. And having said that, I would like to also talk about the premenstrual symptoms. Some women or many of us females experience this premenstrual syndrome or symptoms, whatever you choose to call it. These symptoms sometimes occurs even before the onset of the menstruation. And these are premenstrual symptoms syndrome is also called premenstrual stress syndrome, and it occurs um, as a result of salt and water retention, which is caused by estrogen. Yeah, like I said earlier, there are estrogen and progesterone are responsible for our menstrual cycle. So this premenstrual syndrome or symptoms that some women experience is as a result of the hormone estrogen that causes premenstrual symptoms that we experience. And there are basically symptoms that some of us experience that don't even understand. And some of these symptoms include mood swing. Yeah, mood swing. Some persons experience mood swing at a certain time of the month, their menstrual cycle, or if that is for those who are very keen about the changes in their body. If you are very keen, you will discover that there are certain time in the month or your menstrual cycle where you experience some certain kinds of symptoms in your body, some certain kinds of feelings in your body. So some person experience a mood swing in certain in that in certain period of their menstrual cycle. They experience anxiety, they experience irritability, emotional instability, depression, headache, constipation, abdominal cramps, and bloating. These are the common symptoms that people experience during before the menstrual cycle and before the menstruation actually begins. But some persons, I know some persons are used to the abdominal cramp and bloating. For someone like me, because in this video actually I will also be using myself as a reference because I'm a woman. Yeah, some months are different for me, and I know it's also the same for some women out there. For some months I experience mood swing and just name it, but I know that it's constant. I experience abdominal bloating and cramps most times, as in these ones are constant. And sometimes in the mood I also experience mood swing, irritability. I get angry at every single thing around me. Initially I did not understand, but when I was at the time I became worried. I was wondering what is actually wrong with me. That certain time of the month I become so mad at everybody. Any little thing I flare up and the rest of them. And I began to study my body and to know when this actually occurs. Please pardon me if you hear any noise in the background. I'm at home and I'm not the only one at home. My baby boo is somewhere in the house, so probably is the one making any noise you hear. So please far from it. Let's go back to the video. So people experience different things during before the onset of the menstruation. Like I've already talked about that. And there are different or abnormal menstruation. Yeah. Our normal menstruation has to follow a particular order and pattern. But anything outside that pattern and order is termed abnormal menstruation. And there are different types of abnormal menstruation. And for the first one, I call it, or the science call it, or in the medical language, is called amenorrhea. Amenorrhea it occurs when there is absence of the menstruation, totally absence of menstruation, that is bleeding every month, is called amenorrhea. Why also when there's a decrease in the menstrual bleeding or in the flow of blood is termed as hypomenorrhea. I guess you understand what I'm saying. You have the amenorrhea when there is absence of the menstruation. You have the hypermenorrhea when there is decrease in the menstrual bleeding. You have menorrhagia. Menorrhagia is when there is excess of um, menstrual bleeding, and this most times comes along with when you are having some issues with like fibroid. Women who are experiencing who have fibroid will experience this menorrhagia a lot because fibroid comes with severe painful bleeding, which is another topic on its own, which I'm going to talk about. Yeah, I'm going to talk about fibroid in subsequent video. And you have also the oligomenorrhea. Oligomenorrhea is basically when there's a decrease in the frequency of menstrual bleeding. When there's a decrease in frequency of menstrual bleeding. Polymenorrhea is also there is also polymenorrhea which is increase in the frequency of menstrual bleeding. This polymenorrhea and oligomenorrhea I will talk in detail when I'm talking about the menstrual cycle. I'm just trying to let you understand that outside the normal menstruation that most of us experience, I know many people don't understand their abnormal menstruation. Yeah, many people don't understand. And you have the dysmenorrhea. Dysmenorrhea is the menstrual pain that we feel. Most of us women experience dysmenorrhea and sometime or the other in our menstruation period. And metrorrhagia. Metrorrhagia is uterine bleeding in between menstruation. Yeah, some persons experience this. That's why I had to bring this issue up because people experience certain things in different time or points in their menstrual cycle, which they don't even understand. You could be having your normal menstrual cycle or menstruation, and sometimes in the morning you discover that certain things happen and it's not the same pattern. Maybe the heaviness. Let's use for example those who experience heavy bleeding along the line. You discover that the bleeding has reduced, or maybe you have a lengthy cycle. Those who have like 35 days cycle, 34 days cycle, along the line, discover you are having something like below 21 days. It's something that calls for alarm. Or someone who is having a 21-day cycle, discover that he or she is having above 21 days constantly or above 35 days. It calls for alarm. This some of us experience, and you don't, we don't really take it serious, but I guess that we as women we have to take serious every little changes in our body. Every single change that occurs in our body is very important that we take note of it. And if it becomes constant, then there is need to raise alarm. Yeah, to see your gynecologist to attend to it on time before it degenerates into something more severe and complicated. And menstrual symptoms, yeah. Having talked about, I guess you guys understand. We've talked about what is menstruation, premenstrual symptoms, abnormal menstruation, and now I want to talk about um, menstrual symptoms. These are the symptoms that accompany menstruation. Premenstrual symptoms comes before menstruation. Why menstrual symptoms comes along with the actual bleeding that occurs every month. And you discover that sometimes the two symptoms look alike. So some of the people don't really get to know when either of them is happening. I remember while I was growing up, when I was still a teenager, when I was still a teenager, before my period comes, then I don't even understand measure what's not that I was just as blank as anything. But I noticed that before the onset of my period, like 1 week to, I start experiencing cramps. It comes and it's not like it's constant. It comes and it goes, it comes, it goes, it comes, it goes. So once I start experiencing or feeling those cramps and increase in body weight, then I someone like me, I do put on weight during um, my few weeks or after ovulation. Someone like my once after ovulation, I put on a little bit of weight till after my menstrual cycle, and the weight I return back to my normal weight. So I noticed that was what I used in knowing when okay my period is about to come in so day. So I started expecting it. But as I grew up, that symptoms started going down. I guess for my own case, it came with growing. So that the symptoms that accompanies menstruation, like I said, it's almost the same thing as the premenstrual symptoms. I will have the abdominal pain, this menorrhea, which many women out there experience this. Yes, many women out there experience this menorrhea. I used to know of someone while growing up. Once her period starts, just know that the next 1 week she's not going to leave the house because it's as painful as you can think. Yeah, it's as painful as you can think. She wouldn't move. All she needs to do is just be indoors because the pain is so unbearable. But for now, I don't know if that person still experiences that because then we are still growing up. We should be like in that 16, 17, thereabout. So I don't know if she still experiences that. But as at then, when I knew her, whenever her period starts, she doesn't move an inch because the pain is so unbearable for her at that moment. She can't do anything. She can't do nothing. So that will tell you how severe some persons experience the menstrual um, symptoms. Some persons experience occasional nausea and vomiting, depression, and just name it. Because you should know that these symptoms are different for different women. Yeah. Some persons experience painful menstruation, but it's not as severe as some persons. Some persons experience abdominal pain, and it's not as severe as for someone else. So it depends on our body system and how our body is able to adjust to the hormones. Yeah. So now I guess you guys you've understood menstruation symptoms, abnormal menstruation, and whatnot. So now let's go deep down more, which is the main topic for today. The menstrual cycle. Yeah, the menstrual cycle. Because this menstrual cycle, if you don't understand it as a woman or as a lady or as a female, there are way for those, let's say when you are single, you don't understand this. When you are married, you still have issues because when you're trying to conceive, you need to understand your menstrual cycle to be able to know when to target. Yeah, when to get what I mean. Shoot the shoot to get what you're looking for. Yeah. So you need to know, not just know, understand your body physiologically. Yeah. You have to understand your body mechanism, how your body works, your menstrual cycle, and all that comes with it. When there are changes as a woman, you need to understand this. It's not when you get into marriage you start getting to know all this. But for those who are already married, it's never too late to get to know that for your daughter's sake, so that you'll be able to teach your children, your girl child, what she needs to know. To understand our menstrual cycle as a woman, as a girl, as a lady, because this helps them to avoid conception and and achieve conception. Yeah, if you don't understand it, you wouldn't know when your fertile period, when to abstain from sex, when for those who don't want to conceive, and for those who are looking for the fruit of the womb, when to actually hit the target. Yeah, it's very important as a woman to understand your menstrual cycle.